Coming to a breast reduction, all of you would want to know how is the breast reduction done, what is the anesthesia, what is the recovery period. Let me tell you, breast reduction is one of the least painful procedures. Now, what happens in a breast reduction is we are removing the entire breast tissue, we are removing excess skin, excess breast tissue, excess breast fat. What happens during the surgical technique is we inadvertently anyways cut a few nerves which are around the breast, due to which you have a period of numbness and a weird sensation along the nipple region for about 3 to 4 months. It is a daycare procedure. If it is a mild to moderate breast enlargement and a very mild sagging, it is daycare. You come in the morning, you can go in the evening. It is about a 1 to 2 hour surgery. But if you have an extremely large breast and grade 3 to grade 4 sagging, which means large quantities of skin and breast tissue is being removed, it could be a 3 to 4 hour surgery also. In that case, we may keep you 1 day in our clinic and an overnight observation. And next day morning, usually all our patients go home. You will be wearing a sports bra for about a month after the surgery. I usually place these tight pressure dressings on your chest for about 48 hours. You come back to me on day 3 and I will take off these dressings. We show you how to clean your wounds, do the dressing on a daily basis. Remember, there will be a few incisions and stitches. Those have to be cleaned, dressed and taken care of. Any stitch in the body takes about 10 to 14 days to heal. In a few women, we do see sometimes a delayed wound healing, especially in the area right underneath the breast. For those who are doing the inverted T incision, we see that sometimes there is a slow healing at the point of the T junction. This is because the new weight of the breast is sitting on that T junction and the maximum stress is at that point. So we give you specific precautions on how to take care to make sure that area is kept dry. There should not be any sweating in the area. And as long as it's kept dry, the wound heals extremely smoothly. We give you a post-surgery recovery protocol sheet that will take you through the next 6 months of what to expect and what not to expect after breast reduction surgery. We provide you with silicone creams, silicone tapes, scar creams. Sometimes by the 3rd or 4th month, we start chemical peels and lasers to reduce the appearance of your scars. Obviously, you want to keep the results of your procedure as long as possible. So as long as you maintain a stable weight, you are exercising, not having too many weight fluctuations, the result of your breast reduction surgery is going to be long term. Any weight fluctuations in the body, pregnancy in the future, breastfeeding is going to change the shape of the breast a little. You may develop a little bit of sagging again. It is impossible to predict whether the size of the breast is going to go like how it started off, but you may have to come to us to do this breast reduction procedure and maybe a revision touch-up procedure after you have completed the family. Today's women, being more broad-minded, do not mind scars and they are not sure whether they may have children in the future or not and want to look good now, do not want to live with a large and heavy sized breast. So you need to know the pros and cons of breast reduction surgery and everything that I have explained in the previous video also, and then make a conscious decision. And the best way to do that is to meet me in person, have a consultation, and I can understand what suits you best.